House Republicans celebrating the health care reform bill that will now make its way to the Senate. Joining us now is Tom Price, Secretary of the Department of Health and Human Services. Mr. Secretary, it's great to see you.
Good morning. Good morning.
I earlier said, you know, it used to be Social Security was the third rail, and I'm really starting to think health care could be the third rail. It's just such a difficult, intractable subject for politicians. The Democrats thought, you know, that in their hearts, I think they thought they were doing the right thing when they passed Obamacare, and then they lost 4 straight elections, not the presidential, but 4 straight elections in terms of Congress, decimated the ranks of the Democrats. And I'm just worried that, you know, given the current milieu of you know, what you're hearing in the media, that maybe Republicans need to try to avoid the same thing from happening by passing this. Do you worry about that?
Well, it's a completely different situation, though. Remember what happened with the Democrats when they pushed forward their health care bill. They disrupted the market in health care. They made it so it was more difficult for folks to get care and coverage. Got all sorts of folks out there with an insurance card but no care because they can't afford the deductible. So what we're trying to do now, and we'd love to have the Democrats assist in this activity, is to fix the challenges that have been created by the current law. You've got insurance companies that are vacating the market. You got Medica leaving 94 of 99 counties in Iowa. You got Aetna saying they're going to pull out of Virginia. You got Maryland saying premiums are going up by 60% next year because of the current law. That's what we're trying to fix. So it's a completely different situation. Now, that doesn't mean that the media treats it differently, right, and that's the challenge that we have.
You wrote a great op-ed the other day because you remember Obamacare for 6 or 7 years never got above 40%, really. I mean, there was never even a plurality in terms of approval. But suddenly, when people start seeing maybe people lose coverage, all of a sudden it's over 50% and only 17% want to change it, and you get these numbers. But you point out that centralized command and control usually leads to this. Costs go up.
Exactly.
Costs go up, quality goes down, choices dwindle, innovation stalls, and really only people with money can get decent health care. So to cover the 7% that weren't covered, 93% of the other people get worse health care because of the coverage, but all you're going to read about is coverage and loss of coverage for the next, you know, I mean, I'm reading on Huffington Post that you're killing people. You're celebrating as you're actually killing people. That's what the headline is on these left-wing websites.
Yeah, but yeah, I couldn't have said it better myself than what you just said. But you know that the hyperbole of the left just simply is not true. And the American people understand that in their gut. They really do. And they will appreciate it more and more as this process moves forward. And they understand that what we're trying to do is to fix the system that is failing them right now. Now, one of the challenges we have is that we've got 4 different health care systems. You've got Medicare, Medicaid, the employer-sponsored market, and then the individual market, the exchange market. And it's the individual and exchange market that has been decimated by Obamacare. That's where you've got folks that can't afford their care because of the deductibles and the premiums and the access and the like. So that's the challenge that we have, because these other systems, there are challenges there as well, but they're not as urgent as the ones in the individual and small group market.
Mr. Secretary, let me ask you just one question about pre-existing conditions, considering that the administration has talked about trying to protect those pre-existing conditions. One of the big headlines that has come across the tape over the past 24 hours says rape and domestic violence could be considered pre-existing conditions under this bill. As you know, some insurance companies, if you have been raped or been the victim of domestic violence, you can be categorized as having a pre-existing condition and put into a higher paying premium bucket. Is that the case?
Well, if it's the case, it's because it's the case right now. Now, what the president has made a promise to the American people, and we're fulfilling that promise, and that is to make certain that anybody with a pre-existing illness or an injury is not precluded from gaining the kind of coverage that they want for themselves and for their family, not that Washington forces them to buy. And the protections that have been put into this piece of legislation make it so that we believe that folks with pre-existing conditions will actually be able to gain better coverage than they're currently able to gain, remembering that you've got 20 million folks out there right now who've said, I'm not going to participate in that market because it doesn't respond to the needs that I have.
The other thing, and again, it just depends on which side of the aisle you're on. When Obamacare passed, there were new taxes. The people that invariably pay the taxes are people that can afford to pay the taxes, so they're going to be people in the upper end of the income stream. So now Just
they may or may not.
Right, but that's what you're going to hear. That's going to be the narrative. So now by getting rid of some of the Obamacare taxes, it's going to be branded a tax cut for the rich at the expense of people that can least afford, to lose any type of coverage or you can see how it's going to be portrayed at this point.
But think about some of the taxes that we're talking about doing away with. The medical device tax, which affects every single individual accessing medical care. That's not just going to the rich, that's going to everybody. And what that's doing, as you mentioned early on, is depressing innovation in this country. And so the quality of health care is decreasing across the board because of the depressing of innovation and the inability to stay on the cutting edge of where health care needs to go. So this is a positive first step in this process. And I know that the president looks forward to working with the Senate and making certain that we get a bill to his desk that he's able to sign.
And as far as the Senate being even more, perhaps viewed more as consisting of more moderates than even in the House, what do you think they're going to do, if they rewrite the entire bill? I said earlier that, that Republican principles, there's probably 70 or 80% that they're going to come up with basically the same stuff.
Sure.
What do you think is going to be different that they put into their bill, and will it be palatable to the guys in the House?
I think a couple areas that the Senate will be concentrating on. One is Medicaid. We believe that it's important that those individuals in the Medicaid space are able to continue their coverage or have a seamless transition to coverage that, again, is more responsive to them. Second, there are a number of senators who've talked about the opioid crisis. It's one of the priorities that we've made here at the Department of Health and Human Services, and they may want to put more resources into to address the opioid crisis, which is really a scourge across this land. And then finally, this whole issue of pre-existing, we believe that it has been addressed appropriately in the House, but the Senate may want to take a peek at that and make certain that they are comfortable with the direction that this is going in, so that we make certain that every single individual in this country with a pre-existing illness or injury is not precluded from gaining the kind of coverage that they want for themselves and for their families.
Mr. Secretary, can you walk us through what you think the timeline will be for the Senate? We had a report this morning, Goldman Sachs put one out, suggesting they didn't think this was going to happen until the fall, which they thought then could push off the tax reform discussion until 2018, in which case now you're into the midterms, and they became a little critical or negative about then what happens after that.
Yeah, no, it really is the $64,000 question. But as you pointed out, you can't get to tax reform until you get through this reconciliation package of the fiscal year 17 budget. So, and that's the health care side. I would like, my sense is that it will happen as soon as it can happen. I'm hopeful that it happens within a month or two. But again, the Senate has a whole tempo to its own action. I've had the opportunity to speak with Leader McConnell, and I know he wants to get it done just as soon as possible.
I got to ask you one more, Mr. Secretary. I kind of felt like Jim Comey. I felt slightly nauseous when I heard this last night. Krauthammer, who's kind of a realist, on special report, wasn't Brett, but anyway, last night said Obamacare failed at every level, but it did change Americans' expectations regarding health care. As a result, in less than 7 years, we'll be at a single-payer system, which would have been sort of the Trojan horse that Obamacare was, that just philosophically that we end up there. I guess in 2 years, in 2018, maybe the Republicans lose the House, or I don't know what how you connect the dots, but that's his prediction. That's what Americans want it now, and like every other major country, we go to single payer.
Charles Krauthammer's a bright guy, but I'll tell you that the American people don't want the government running their health care. That's one of the things that they're objecting to strenuously. And that's why we've seen a decrease in access, an increase in the cost of health care, because the federal government's been involved. Decrease in quality, decrease in innovation, all the things that the American people want, that is accessibility and affordability and quality and choices, they're expanded when you allow them to be able to make the decisions that are right for themselves and for their families, not Washington dictating that. So I don't believe that the American people want that. I do know that that's what many on the left want.
I know.
And that's why I believe that the Senate will act expeditiously as they can to make certain that we do get a bill on the president's desk that he's able to sign that will improve this health care system for every single American.
Mr. Secretary, before you go, I was just curious, did you get a chance to see the monologue that Jimmy Kimmel gave earlier this week that seemed to go viral?
I saw it on replay, didn't see it live, but again,
what did you think of that?
Well, I mean, what he's putting a face to are the challenges and the concern and the fear that the American people have. And that's where we need to communicate that we believe that every single American needs to be able to have access to the kind of coverage that they want. We don't want anybody to be without coverage. Remembering that there are 20 million folks right now in this nation who've said, I'm going to pay a penalty. I'm going to suffer the potential penalty from the IRS or ask for a waiver because what the federal government is doing for them as it relates to health care doesn't respond to their needs. We need a better system. That's what the president and we want.
Yep. Mr. Secretary, thank you. We appreciate your time.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.